All right, it is recording. This is my first podcast, Rock Solid with Crystal Fambrini. I'm Crystal Fambrini, where this podcast is all about understanding what expectations are, breaking through them, getting grounded, and living your best life, whatever that looks like to you, your most rock solid life. And with me today is an ER doctor. He has decades of experience. He's also my boyfriend of a couple years. This Dr. Stephen Van Roekel. Hi.
Hey there, how are you?
Good. It kind of echoed a little bit. Let's try that again. Hi, Stephen.
Hi, how are you?
Oh, good. That sounds good. I'm okay. You know, I don't know if you know this, but today's May 1st. Crazy day. Literally outside of my house a couple hours ago, a garbage truck exploded.
Wow.
Did
Yeah,
you
I
see
saw
the
the picture. That's kind of crazy. What happened exactly?
I don't know. They just had something wrong. No one died. No one got hurt. The garbage truck literally caught on fire and exploded. And since everyone's practicing safer at home here in Los Angeles, everyone came running out. They just cleared that out. So that was my
Wow.
day. And then I set up the lighting for this, and one of my lights broke, which is fine. So if there's more light on this side than that side, but this is a work in progress. This whole COVID-19 experience, there's lots of breakdowns, little and small, and you just learn to roll with it.
We're going to have a better rest of the day.
And so you're in Austin right now.
Yes, I'm in Austin, a non-COVID hotspot, but we're still busy.
Yeah, and I'm in LA, and we have a long distance relationship. We've had it for a couple years, and I want to get into that with our listeners and viewers because we're doing a video podcast as well on my YouTube channel it's youtube.com/Crystal Fambrini. But first, before we get into our personal life a little bit, don't worry. Don't be scared about it, your face. First, tell me, today's May 1st. It's the first day that Texas has supposedly opened up. You know, like the restaurants can seat like 25% of what they could have done before. Have you been noticing any differences today on May 1st?
Well, everybody's been dying to get out, of course. I called multiple places just to see if they might be open because I was potentially going to go to something. However, they're doing that, social distancing with a mask. I'm not sure how you eat with a mask on, but I called a few. Nobody that I've called has been open. So I think everybody's gotten their own schedule. I've heard people saying the 21st, the 18th, the 14th. I've called multiple places. So they're just not popping open just because it's May 1st, in my opinion.
All right. And you are an ER doctor in Austin. You actually are part owner of Express ER. And it's been stressful for us. It's been stressful for you. You've actually had to deal with people that have COVID-19. And tell us, I guess, I know there's so much to go through, but what's like the same question that people keep asking you over and over again from your people who have access to you, from your family, friends, and even I know you've done a couple news reports. Like, what is the same question you're getting?
Everybody just wants to know how you're doing and what's it like where you're at. So where I am and where I'm working, of course, it's a freestanding ER that it's, it's separate from a hospital. They don't have these in every state, so people don't know what they are unless you come from a state that have them. But it's a standalone ER, so the overall volume is lower than a hospital, but we still see, the staff is a lot less as well. So we still see plenty of patients and have a lot of people coming in for COVID testing because we recently got the antibody test, and we've been doing 50 patients a day since we got the test. So it's been kind of increased volume in the last 4 or 5 days significantly. So for us, the stress has gone up a little bit. We're wearing the equipment, all day, every day. You leave there with your face dented with the mask. And then out of those, some of them are sick. And then we have the rest of our ER patients sprinkled in there as well. So it's a busy day. And fortunately, the nights are less busy and you're able to get some rest usually.
Because you're doing 24-hour shifts, and there were a couple days that you did 48-hour shifts. And what is it like for you as an ER doctor? As I mentioned at the beginning of this podcast, you have, over 20 years experience. What is it like for you participating in this COVID-19 experience?
Yeah, I mean, we've been, we've always seen sick people and people that could injure you, infect you with, HIV needle sticks or tuberculosis or whatever they may have, and you never really know what the patient has. But this has been completely different and a lot scarier. it's just been, this is the scariest time it's been since I've ever been an emergency doctor, because anybody really theoretically could get you infected and you could have a bad outcome. Although, thank goodness, from the latest projections that I've seen, I think it's going to be way under 1% mortality. So that's very comforting, at least from what we know right now.
So, you've seen some gnarly things, you've experienced some horrible tragedies, you've seen a lot of death in your career, and you're saying with everything you've seen, this is the scariest.
Easily the scariest. Again, where we are, we don't have freezer trucks out of the hospitals yet, hopefully ever, for the dead bodies. But, as you know, my sister lives in Brooklyn, and I've gotten multiple pictures and accounts of what could happen. And if that did happen here, it would really be a disaster. It's a disaster for those heroes up there. And that's really scary just to watch, listen, see reports. But down here, yeah, I mean, we admit someone to the hospital. We talk to the ICU doc. I know what's going on in there. They still have plenty of sick COVID patients at risk for them, and ours are at risk for us as well. So it's for sure been the scariest time ever. So I'm just hoping it goes away at some point relatively soon, but it could linger for a while. So that's what I know.
And in addition to working in the ER, you've also been doing a lot of telemedicine. And I know you've had some big aha moments in telemedicine where people are calling you scared to go to the ER when they need to go to the ER. Can you tell us about that?
Right. So exactly. The first phase of this entire situation that is occurring right now in the United States, we all prepared for a disaster in the ER, shored up all the equipment, and thought we were going to be overrun quickly. While that did happen in a couple cities, it didn't happen in most. And in most, we had a massive volume reduction by about 50%. And we just thought people weren't getting injured or getting sick because they weren't leaving their house, which sounded reasonable until I started doing bunches of telemedicine phone calls. I've been doing it for 5 years, but I don't take a lot of calls. I have in the last 6 weeks taken about 600 calls. And that's where the volume is. About 40% of those people should have or could have gone to the ER or an urgent care. And they say the same exact phrase. They say, I don't want to go to the ER and catch COVID. So, you have to go through their conditions. And then even when I refer them to the ER, about half of them, well, all of them are unhappy and half of them refuse to go. I mean, they're terrified to go into the ER. So that's where the volume went. And that's where I kind of learned from telemedicine is as they shifted over there, but you can't take care of those patients over the telephone, not those emergency patients. So, that's a risk for the public. There's people suffering at home. And when this is all said and done, I do think that there's going to be way more morbidity and mortality from people not going to the ER than from people, dying from COVID-19.
So let's talk about the tests. I've been listening to NPR every day. I'm like addicted to it. I love it. I'm listening to a lot of content, and there's a lot of talk about these tests. And some of these tests don't work, or they have like a mistake rate as high as like 14%, saying, and how do you know you have a test that's working? I mean,
so 14% mistake rate. So let's put that in a different term. That's actually pretty good for right now. I mean, this started out, first test that we got around our area that I was aware of were the swabs, and they were on the PCR swabs, polymerase chain reaction, stick it up your nose back into the nasal cavity, get a sample, and then they send it to the lab and they check it for DNA. And that's a test to determine if you currently have COVID-19. If you have a positive swab, you have it, period. Well, you had it when they did that swab. And of course, you're going to have it for a week or two after. That's still yet to be exactly determined. So those are the swabs. Then the first blood tests that came out of China were the antibody tests. Now they had a high false positive rate because, as you know, coronavirus, or as you may or may not know, coronavirus also causes several other things, the common cold being one of them. So someone could have a positive coronavirus test and they didn't have COVID, they just had a common cold, and then they'd have to quarantine and think that they had COVID when they didn't, and that was a problem. But the test that we just got have a specificity rate of 93%. So if you want to use your word of false positive rate of 7%. So we had the specificity of 93%, is pretty good.
And what are those tests that you guys have? How do you take them? Is it a blood test?
We do a finger prick. We
You
get
do
a couple drops of blood into a little vial that it comes with some solution in it. Mix that around. You put those solutions into a little cartridge. A couple drops on this side, couple drops on this side, and it goes up the screen, and you look for lines to appear, and they test for antibodies, IgM and IgG. So those are immunoglobulin, and the IgM would come first, maybe after a week of being infected, or 3 days, or 4 days, or 7 days. It's not 100% at this point. Nobody knows 100%, but it's the first one to come.
Okay, so let's slow down a second, because you know a lot about this, but I just want to just talk a little slower about it so we can really understand it. So this blood test that you do you do that one if you think you have COVID-19, or if you thought you had it?
You could do it for both. Do it for both. It's used as a screening test.
So that means that this blood test that they're now doing does it seem to be much more easier to do than that swab?
So it's a lot easier to do. And it's
because that swab, like my girlfriend, Angela's son, she had COVID-19 and she was in the hospital in Australia. She actually got stuck in Australia for a couple of days. She was at a wedding and caught it there. And she did a video live showing the process, which I'm sure many people are familiar with that now, with that long, what is it called that they use to put up your nose?
It's just a swab.
The long swab. It looks so swab, and it looks so uncomfortable.
Yeah, it's a little uncomfortable.
But so now you're saying, I mean, that's super scary. I mean, for me, that freaks me out. But now we're saying if you think you have it, you don't necessarily have to do that test. You can do the blood test.
So the swab is the confirmatory gold standard test.
Oh.
Positive swab, you have it, period. Okay. Now, the blood test that came out that we have, again, the first generation out of China were 50%, 60% specific, meaning there was a lot of false positives. Okay, so you would do that as a screening test, then do the swab, and if the swab is positive, you got it. Now, the new tests that we have are 93%, according to the package insert, specific, meaning a lot less false positives. So if you have a positive blood test or the current system we're using, it's highly likely that you have COVID, but we're still doing the confirmatory nasal swab, okay?
Okay.
So it's really needs to be determined in the context of your presentation with the physician who's treating you. But if currently we're checking asymptomatic people and symptomatic people. If the asymptomatic people come in and they have a negative antibody test, I mean, that probably means that they didn't have it. And although it could be lagging behind by a few days, statistically speaking, they probably don't have it. But any positive antibody test, even if they have no symptoms, we are swabbing them, because if it's a positive antibody test, it could have been still from a month ago, 5 weeks ago, 4 weeks ago, 3 weeks ago, and we're swabbing them. If the swab is positive, we know they're currently infective right now. So the swab is the confirmatory test.
So what are your patients like when they come in? How are they feeling? Are they extra scared? What's that like?
The two categories. We have the walking well who just want to be tested and they possibly were exposed. So somebody who works at the grocery store and they had 400 people coming by them every day. That person who has no symptoms and they're just scared, and they get a negative blood test and they're really happy. If that same asymptomatic person gets a positive blood test, I've seen them, break down crying, and then, we'll do the swab and we send them home in quarantine and deal with that over the next few days. That's one category of patient. The second category is the very sick person who comes in with chest pain, shortness of breath, trouble walking due to shortness of breath, fever, body aches. That's a scared person already. So that patient we're treating, doing more things on imaging, blood work, potentially admitting to the hospital and not. That's a whole different category. And those people are already scared and have been scared for days.
So, this is an interesting time because everyone in the world is experiencing this. We can't escape this. It's like we can't go on a plane and fly somewhere else and get out of what we're in. And so there's a lot of collective fear going on. There's a lot of collective fear with people who have it, who think they might have it. There's people stuck in their houses, afraid to go out. The doctors and nurses, such as yourself, you must, are scared to get it. How do you deal, because you're under so much pressure every single day, and we're now heading into month 2. How are you dealing with the fear and the stress?
Obviously the gyms are closed, so that's a major problem. I do have some weights in a back room at our emergency department. So I've been riding my bike. I mean, this is actually pretty nice. We have this awesome trail, as you know, but I wasn't aware how awesome the actual trail went all the way down to work. I can ride to work along the water on the trail. So I've been doing that. The weather here is beautiful right now. And then I'm going into work, getting, a less than stellar workout with my less than stellar light equipment, and then riding home, and then eating healthy, trying to sleep healthy. And for me, I've just, as you know, I've been playing saxophone every day since the quarantine started, and picked that back up. And that's been really my primary outlet. I've just been playing an hour or 2 every day. So.
And what is it like when you pick up the saxophone to when you end? Like, how do you feel your stress and your anxiety shift when you're playing the saxophone?
Oh yeah. I mean, took a while just to get notes back out, but then over the last few weeks, it's been real fun and getting sort of back into, after 28 years off of playing. And so now I'm back 5.
Right. But I'm saying, what does it feel like, just that experience of when you're really stressed and then you pick up the saxophone and then you set it down? Like, how quickly can you shift your stress by doing that?
Yeah, it's just music. It's really great. It's a great stress reliever. It's also a little bit of a breathing workout. So when you're done, I just played before here, and I kind of feel like my voice is hoarse, and it's a little bit of a workout for your respiratory system. But then mentally, it's just great. I love the music, and I love playing and just getting notes out and sounding. It's just a new instrument I bought. It's all just a great reliever, and it's really been my primary outlet.
So what do you advise, your patients who come in and then they get tested positive and they have to go home and quarantine? And do you advise them on how they can keep their stress down and ways to stay healthy while they're in quarantine?
Eat healthy, sleep healthy, and to the extent that you can, try to be moving around. Now, my asymptomatic patients, again, if they're positive and asymptomatic, yeah, we have them quarantined until the swab comes back, but they can continue normal fitness if they have any level of whatever they were doing. My sick patients, I mean, if they're not sick enough to be admitted to the hospital, but they're still have it and sick, I mean, you're telling them, walk around. If you're having difficulty walking, call us back. I mean, breathe deep. We call it pulmonary toilet, which is, coughing and deep breathing frequently throughout the day.
Wait, what is that? What is pulmonary? What is it again?
It's called pulmonary toilet, and it's actually, there's a few things, and they may not have this at home, but at home they can take a deep breath and cough and just make sure that they're moving around. So at the best that they can.
Why is it called that?
I don't know.
Is that the term that the doctors use?
I just learned that when I was a resident, and it's been ever since. So that's what I've used. You would actually order pulmonary toilet on like a pneumonia patient on the floor, and the nurses would bring this machine, incentive spirometer in, and they would breathe deep and cough, and sometimes it's chest padding or back padding or whatever. So there's a lot of things it could be, but so yeah, that's what I tell them.
So how has this affected your life in the last 2 months? I mean, I know, but people that are listening or watching might not know.
I mean, yeah, it's, you walk out of somewhere in scrubs and everybody walks really far away from you. I just took trash.
Wow.
I just took trash down the hall, and my complete saxophone buddy next door. I mean, he's like, I can tell he's kind of scared to be around me right now. I don't blame him. That's fine. But, people, the ER docs, myself included, I mean, people don't really want to be around you. Currently, I have, my hospital ER docs, some of them are living in the garage and staying away from their family. And that's really kind of a mental disaster. So yeah, it's been just tough. I mean, I've just learned to hang out by myself. And I mean, there's people that, as we've discussed, there's people that live like this. I mean, we don't, but there's people that live like this where they just hang out by themselves and stay home and read and don't ever go out. I mean, there's people that do this. And so I've been doing it, and it's not the biggest disaster, I guess, but I don't want to continue it, but it's not the end of the world. It's been okay.
Interesting. My experience would be different from that. Mine would be more dramatic, but maybe I'm the more dramatic one in the relationship. Because we haven't seen each other for 2 months now. Now it's 2 months. So let's switch over. Thank you for talking about, your experience as an ER doctor with COVID-19, and maybe we'll get you on a little bit later in a couple more weeks with the latest updates, if you don't mind. Mm-hmm. And now I want to talk about dating an ER doctor in the COVID-19 era. Or, having a relationship, like how we're having a relationship like this. Essentially, we're doing a podcast, but it's also like a video virtual date at the same time.
Right.
And, I don't know if a lot of people know this, but Texas, Governor Abbott, he's a Republican, he closed down your state. So meaning your borders are closed to certain states, such as California. So I can't fly from California to see you right now without signing a release. I have to sign this sheriff release or something my friend was telling me about, and to say that I agree to be quarantined for 14 days, which is just, I guess it's working because it's keeping me out, right? I'm not coming to visit because that just seems like a lot. But at the same time, now, while the borders are still closed to certain states, you guys are opening up today. So it'll be interesting to see if he changes the border rule.
Yeah.
He hasn't done any executive orders yet, but we've been doing a long distance relationship for a couple years now, and you've had long distance relationships in the past. We both have, actually, but this takes it to a whole nother level, in my opinion.
This would be what it would be like if somebody lived in Australia and the other one lived in the United States, and you just hung out a few times a year or something like that. Well, I had a friend that did that, and that's what they did. Yeah, because we used to just go back and, just throw on a backpack and get on the airplane and go at any point in time, which that'll come back. It's just not that way right now. It could probably get you here by El Chapo's tunnel if we had to, but you could get here. But then the whole issue is I just keep waiting to see if possibly these, if I'm seeing 50 patients a day that might be sick, then that's a problem.
Yeah, even if I was there, we talked about this when this first happened prior to, Texas closing down. It's like, well, I could fly there, but then you were saying you wouldn't want to sleep in the same bed with me even. I would have to stay in the guest room, or we'd have to be on different sides of your place. And I'm like, because that's what your doctors are doing, right? That's what your colleagues are doing that have families. They're not living in the same area. So that didn't really make sense either. That seemed kind of weird. And in the beginning, so much was unknown, and it was super scary, and are you still at the same level of worry as you were in the beginning, thinking that it's possible for you to catch this as a doctor?
Well, yeah, I'm less concerned overall about getting super sick from it as I was at the beginning, because the statistics are just going to come out, in my opinion, from what I've seen and followed. It's going to be, in my opinion, under 1%, probably way under 1%. The scariest thing for me would be to be in that category of the other 15% that are just very sick and then don't die. And then you have to recover and go through rehab. And that would be the worst case scenario for me. And then I kind of guess if you just end up getting it and don't have symptoms, that would be, I guess, the blessing, but we're still not certain whether you're going to have antibodies to protect you in the future. So either way.
So with us, we talk about, okay, even if Texas opened up its borders, you're still in the ER on a regular basis treating people who have COVID-19. So at what point, and we're just an example. There's other people like this, I'm sure, perhaps not as extreme as us, but there's lots of people that, are dating nurses or physician assistants that are working around this environment that are thinking the same thing, at what point is it okay to see each other again, or to be in the same quarter? And is that going to be contingent upon a test?
I mean, that's one way. There's a lot of ways. I mean, I've heard it all different ways. The other ways I've heard is that, you know, just the healthcare provider being asymptomatic is just hanging around their family and quarantining together. That's one way. Another way is that they're staying completely apart. Another way I've heard is, getting the antibody test, which is the screening test, and then, you haven't been at work for a few days. The chance of missing the antibody test by a few days still exists, but you're probably statistically okay. And then they're hanging out for that week until they get back to work. I mean, I've heard every scenario.
So speaking of the test, you did do an antibody test this week. It was your first test you took, right?
Correct. Negative. Yeah. So I was negative. I was actually hoping it would be, if I had it and was asymptomatic, I probably was hoping for the IgG and just to be asymptomatic, because that's what everybody I think would want. But it was just, I had negative on everything. So
how quickly does it take, like after did you do it yourself?
No, the nurse did it. It's 10 minutes.
Oh, it takes 10 minutes?
Yeah.
So you had to wait 10 minutes to know if you had it or not.
Yep.
Or maybe had it in the past.
Correct.
Were you nervous during that?
A little bit.
Yeah. So when you saw it, you weren't necessarily relieved.
I was actually surprised. I thought our whole shift checked it. We had 4 of us, and none of us, we were all negative. So I was surprised. We've been wearing the equipment, so I guess so far it's been working.
Right. So the doctors and I know you've had some colleagues and some friends, some people that have gotten COVID-19 working in, various ERs and hospitals around the United States. Why do you think you've been able to not get it and they did get it? Maybe they got it outside of the hospital, or?
Absolutely possible. You never know.
Mm-hmm.
You just never know. I've been wearing the best I can, the equipment, and so is everybody. But yeah, you could get it. I mean, you could just get it at the grocery store. You could get it anywhere. You could. So, but at work, yeah, I mean, you just wear the equipment and do the best you can. There's just nothing else you could do.
So, I'm getting more used to this conversation with you because, we've been having it a lot in the last 2 months, where it's when do we get to see each other and we have no response? Like, I don't know. And that's the same type of conversation that I'm having with my mom. My parents want to see me and they're like, well, let's plan something. And it's like, now what can you plan right now? Right now is literally just, day by day.
I kind of think we the reopening, graded reopening of start at a certain level, see what happens, pick it up a level, see what happens. And I just think that's what should happen for the reopening of everything, really. So.
Yeah. And then, and then people are saying, right, I don't know how to say this, but like people that are dating, like single friends, they'll call me up and be like, tempted to go meet a guy that they met online. And I'm like, don't do it. We're in safer at home. Don't do it. Have you been having any type of conversations with like your single guy friends that are getting like antsy at this point? Because now you guys in Texas, it's the May 1st. Technically, like your single guy friends could like go on a date tonight, right? I'm not saying you will, but I'm just saying like you could in Texas.
Right, they could. They theoretically could. So
interesting. So that's going to be interesting what shakes up with that as well.
Yep. I mean, I've had some friends that have gone on some dates and
how?
Just
what do you mean by dates? Like virtual?
Chance. I don't know, going with somebody to a park or something.
Okay. And how has that been? Like, is it?
I mean, I haven't really followed up or anything. I just heard
You've been busy.
Stories.
Just like meet new people in the park. That's okay. That's one way you could do it. Like you go on a walk 6 feet apart.
Right.
What do you think about this? I mean, everyone's talking about stay 6 feet apart. Is it really 6 feet, or is it further away than 6 feet, or what's the deal with that?
I just can't comment on that with authority, because it seems like a reasonable, you can hear every category of strategy and distance, and I've heard multiple. 6 feet is probably reasonable. It's probably reasonable to me. So that's just my take on that.
Now, when you started as an ER doctor, did you ever think that there could be a pandemic like this? Is this something that you guys, so.
I actually didn't. I mean, the movies you watch, Contagion or whatever, or is there one called Virus? I forgot.
It's called Contagion. That's right. Mm-hmm.
I've seen a couple movies or one at least, and you just can't. But that's actually what we're doing.
Yeah.
Kind of,
so you never thought that this wasn't in your.
Yeah, it's just still unbelievable, really. Just still unbelievable, but it is reality, and so that's what's going on.
So what do you think, we see a lot of the doctors that are on the news talking about this, and is there a certain doctor or a certain hospital that really sticks out that you'd like to commend for during this time, or a certain person of authority that represents the healthcare community?
Well, obviously let's talk about the woman who committed suicide in Manhattan, the Manhattan medical director, emergency physician, medical director, and she was the medical director of a busy Manhattan facility or hospital where they had a lot of COVID patients, and she just saw a lot of terrible things. She caught COVID herself and then went home and recovered and then went back to work and then ended up committing suicide. And there couldn't be anybody to commend higher than that. She's just the ultimate, absolute, true definition of superhero. I mean, to cause her to take her own life, the stuff she had to have seen and dealt with. And I've been a medical director for a bunch of years, and I can kind of imagine how many people were relying on her, and it I just haven't heard a worse. I don't think I've ever heard a worse story since I've been in emergency medicine of anything that's happened to an emergency physician. Beside that, it's just the most heartbreaking, terrible story.
And it's my understanding that she was in her mid-40s.
She was exactly my age. She was 49.
Oh, wow. Okay. So that really hit home because it was someone doing,
It's probably somebody I saw at a conference. I've been to so many, and everybody goes at some point. So it's probably somebody, and we're all the same breed. I mean, 95% of ER docs, just same breed. And so you could just put them in a room and they just talk about the same thing, get along. And probably that happened somewhere. I can't remember it exactly, but yeah, I mean, just heart goes out to all of the ER docs, my own people, nurse, everybody. But that woman, there probably will be. I mean, they need to name the hospital after her, the ER after her, have an award at ACEP, American College of Emergency Physicians, or something, a fund. I am hoping that it's not another person that happens to, though. I mean, hopefully there's not more to come.
So what do you think that doctors can do, or the healthcare industry can do, to avoid something like that? Or
wow, if you're in a hot zone like New York, I mean, you'd have to more doctors and rotate them more with more rest time. Mm-hmm. That's really the only option I could see. The patients aren't going to stop coming, but more coverage would be helpful, I guess, in that kind of situation.
And what about having like therapists or mental health experts?
Of course. Yep. Mental health, they should have that available to anybody who wants it immediately for free. So that should be an immediate standard for ER, any physician, any personnel taking care of these patients, anybody, mm-hmm. needs that support. So.
Yeah, no, that is tragic. It's very sad. There's a lot of very sad stories that are out there, and it's very scary and overwhelming. And, you're in a very stressful situation. Do you watch a lot of the news, or are you limiting yourself on how much news you're watching?
When I have spans of days off, I don't watch. So, and everything changes every 3 or 4 days. So literally things could have changed in the last few days. I don't know the latest New York updates. I don't know. I haven't had the TV on. I've just been riding bike, playing sax and fresh air and eating healthy. I haven't really seen any news, but I start working again tomorrow, and we put the news on in the background, and you'll kind of catch up on everything in that mm-hmm. fashion. So
that's good. Well, I know that you are really good about getting your sleep. You're able, you tell yourself what time you need to go to bed at nighttime, and then you actually go to bed at that time. And you do the things prior, if you need to take a bath so you can get your mind in in the right state so you can go to bed. You do that. You also take melatonin. Is that something
Actually,
that
the melatonin works pretty well.
Mhm.
And the other thing that I've tried has been it's called doxylamine. And I mean, I can't recommend anything to anybody. I'm just telling you what I take. I've tried everything. I mean, I haven't done the prescription stuff. I don't want to go that route, but you have magnesium. You can take, melatonin, magnesium, Benadryl. Of course, Benadryl is kind of a hangover in the morning. At least for me, it is. This doxylamine is I think it was under a Unisom name, and I just got some more generic from the pharmacy, very cheap. And so I've been using that with melatonin. That I sleep through, and that's been pretty good for me. Of course, can't recommend for anybody else, but that's what I've been using.
So, and that you take it and then about 20 minutes later, it starts to hit you?
About 25 minutes later, you're just really ready to crash out and you just sleep through.
Right. Are you having dreams?
Huh. I mean, probably.
You don't remember.
Everybody's having dreams. I don't. Yeah, actually, I had this dream. This was crazy. I was watching that Money Heist.
Mm-hmm.
Yes, I was watching Money Heist. And the guy with the beard, the main character, the professor, I had a dream. I was treating him as a patient. And I didn't have a mask on.
Mm.
And he was super sick, but I didn't think about it at the time. I mean, coughing, spewing stuff everywhere. And I had a dream that I was in there and didn't have a mask on, didn't figure it out till I left the room. And then I kind of started to, I don't know, I felt like a terror, I guess. And I woke up and I was just glad that it wasn't a true thing. But yeah, it was kind of interesting.
Yeah, it's your subconscious speaking to you to not forget to always wear a mask, and
Right.
that fear that's underneath that if you don't wear a mask.
Right.
Yeah, that's scary. All right, well, is there anything else that you'd like to share?
Oh man. Well, I hope everybody just doing the best they can to stay mentally well. There's a lot of people struggling with that. I mean, there's people, everybody I talk to, some of them short fuses, not doing well. And it just, everybody really is hurting from the lack of interaction. Again, I think we're headed out of that. I'm hoping. So I think everybody needs to keep their mental health as tip top as possible, eat healthy and sleep well. And, that's my advice to everybody.
Yeah, and I know when I start to get a little on edge, the first thing you say is, have you worked out today? Because you think that's super important for mental health. And I have to say, I was having a hard time sleeping because I would be just watching so much news, and then, it goes in phases. All this goes in phases. Like, I was really worried about you in the beginning for the first 2 weeks, and that was freaking me out. And then the news was freaking me out. And then going outside and going to the grocery store, like on Easter, I had on Easter, I had my first panic attack in regards to this, which was, right. I wasn't expecting it. It just happened, and I think it was me scrolling on, social media and seeing everyone with their family. And then, I don't want to do a whole poor me thing, but I'm by myself. And at that point, I'd been like 6 weeks by myself. And so then I was feeling, oh, poor me. And then I go to the grocery store, and it just freaked me out how the world changed so quickly. And then after I had that breakdown, I realized, like, okay, I needed to switch it up, and what can I do? So I went and immediately bought a whole bunch of masks, and that helped me feel better. I don't know. I wasn't really wearing masks before that. And now now it's kind of like the monotony for me. It's like opposite of what you're dealing with, because while you're on this huge, never been busier and all this stuff is happening, here in LA, like the agencies are shut down, like everything's really slow. And I mean, I have a ton of projects that I'm working on by myself, but to be able to get in that mental mind state to like wake up on time and start working and start doing stuff, I found kind of challenging. I go in waves. I'm good for a couple days, and then I'm not good for a couple days, which is okay. I'm not like beating myself up about it, because I think that we're in a marathon. But I found myself by bookending walks. So like first thing I do in the morning is I go for a walk for like 2 to 3 miles. And then at nighttime, before I go to sleep, even if it's like at 10 o'clock at night, I'll go for a walk for 2 to 3 miles. And that's been really helping me. That helps me just.
Agreed. When the sun's coming down and the colors are changing, I just love being I'm doing that. Going to do that tonight too. So
You're gonna go for a walk?
no, I'm going to ride my bike.
Yeah, you're riding your bike. I can't ride my bike because I'm a dog, so my dog likes to go with me. But all right, and then I know you were considering getting a dog during this, which is a little unrealistic because you're doing 24, 48-hour shifts.
But yeah, I don't know. That would be nice.
To have a dog.
Yeah, it's not gonna. Yeah, working 24-hour shifts, it's kind of hard, and then you can't during this situation. You can't get people to walk it. They don't want to come in your place, and it's just that would be difficult. But yeah, I'd love to have a little dog.
I'm sorry that people are scared of you when you're in your scrubs walking around.
Well, it's the way it is. So.
All right. Okay. This is the end of our podcast / virtual date.
All right. Well, you look pretty.
You look handsome.
All right.
Okay. Bye.
Okay. Have a good evening. Bye-bye.